So the question is, what could you, so let's say that this cap was triggered, what could you do to improve it? There are lots and lots of wonderful guidelines out there, and these are just a couple of examples. There's a thing called the Hartford Institute for Geriatric Nursing, has a lot of great information, again, the kind of standardized stuff that's evidence-based, that's really helpful. There's a thing called a Consult Geri, which is really helpful to see what you could do. We have the RN care guides. There's other things out there, but for your facility, what are they using to help them guide their care? There's a lot to use out there. It's just something that maybe as a team you guys decide that that's what we're going to use. So what needs to be maintained? What does the resident want? Now I find this very tricky. I have 2 residents that I know of in a couple of my facilities that I want them out of their room, right? They don't want to get out of their room. They don't want to get out of their room. And so what's the balance here? This is what they want. They don't want to leave this room. Now, I need to look at depression and I need to look at all sorts of things. But then there's this, like, I know that if I get them out of their room, they'll feel better. So it's this kind of back and forth. The other thing that we brought into that is what the family wanted. And of course the family didn't like seeing her in a room all the time. She did seem a little depressed, which she was. So all of that, but what the resident wanted was not what we wanted. So that was very tricky. Okay, so risk factors that should be addressed in care planning. So for functional decline, these are the other things. Again, depression. The reason why she had functional decline is because she was pretty depressed. So we need to deal with that depression as part of that. Pain, medication side effects, acute illness, injuries, decreased mobility, prolonged bed rest, including the use of physical restraints, and then change in environments and routines. How this could be, so one of the things, again, bargaining, helping that person, and just having it limited, like all you need to do is go out in the lounge for half an hour, and that seemed to work with her. The resident will encourage to perform self-care, supervise independently with limited assistance. Another example would be if the resident shows change in level indicated in a care plan, report it to the nurses. So that's something that the HCAs could do. The HCAs could then say, look, this is what we're going to try to do, but please let me know if this changes. So that's a really clear care planning kind of thing that we can do. The other thing is trying to work with the RN staff about PRN use, particularly with, one of the things that worked for me just recently is we use a lot of sleeping medication in residential aged care. I think it's one of the things that we could probably work on. I think we use way too much of it. So I had a gentleman who was cognitively intact, and I said, look, this is the thing. If I give you this Zopiclone every night, you're going to get used to it. So what I'm going to do, and if it's okay with you, is I don't want to give it to you every night, but I will give it to you as a PRN, and then if you just only do it every 3rd night, every 4th night, you won't get used to it, and it'll still be effective. And it worked. And so by explaining to him really clearly that this is the reason I didn't want him to have a Zopiclone every night, it really did help tremendously. So now he monitors it himself. He only does it every 3 or 4 nights. Now this is a gentleman who would follow rules. If you asked me to do that, I probably wouldn't. But that's, for him, it worked. To me, that's person-centered care. To me, that's talking with him and saying, look, these are the issues with this medication, and trying to work with him about what would work. So outcome examples, I just kind of gave you one. For me, that would have been a really good care plan is the goal is to decrease the Zopiclone. The action was to negotiate with the resident about use and using it only in PRN. The result is he is now actually only using it every 3 or 4 days.